Now, here is when another specialist, that is the radiologist and the pathologist, they also come into the picture.
Yes.
Blood test investigation, that is the blood test and sonography, they are very important in pregnancy because as science advances, so it has become very easy for us to diagnose many complications. We can foresee these complications right in the first and the second trimester also. And for these reasons, to know whether the baby is fine, whether the baby is healthy, whether the mother is going to be healthy throughout the pregnancy, it's very important to perform all these tests as suggested by the gynecologist. Now, when we talk about blood test, first thing I suggest is that right when you come to know that you're pregnant or in the preconceptional period, you have to get other hormones checked. Basically, the most important hormone that has to be checked is your thyroid hormone. So a thyroid function test is very important conceptually or in the first trimester, because thyroid hormone again will be important in the baby's physical growth also. So nobody, like literally many are not aware of this, that what is the connection between thyroid and the baby's growth. So this is because if thyroid hormone is less, then there may be severe physical deformities in the baby.
Okay.
So this hormone has to be checked. Then second thing is that the complete blood count, to know whether there are any kind of infections, to know the level of hemoglobin, and the blood sugar levels, to know the diabetic status of the women, because even this is going to decide what complications she may have later on. Then even HIV and HbSAg, that these tests are for HIV is for immune compromised state or AIDS, and HbSAg, it is for hepatitis B. Why these tests? Because we get lots of questions. Why only these two tests are done? And we take so many precautions on why these. It is important because these two diseases will change the course of the treatment. If in case a woman has by chance, because this is not that rare, we do get cases of hepatitis B. So if it is the case, if it is positive, the line of treatment changes a little bit. And even like after delivery, the baby also needs treatment for this. So it has to be confirmed right during pregnancy. And again, urine examination, see if there are any urine infections and all. These tests are to be done. And again, essentially, blood group has to be confirmed then and there, because we can never predict, like if the woman, she is going to land up in any kind of complication. There's no time for going for these blood group testing and these complete blood count test and all. It has to be noted down so that the blood group is known to the patient, known to the attendants. So it has to be done. Why hemoglobin? Now, whenever we talk about blood tests, the first thing that comes in our mind is hemoglobin level.
Yes, only HB. Yes, ma'am.
Yes. So this is because the hemoglobin is something, it is a protein which is connected to the iron, and this iron attaches oxygen in your lungs and carries it to the fetus, the baby, and then brings carbon dioxide from the baby and then releases that from your lungs. So baby is not going to breathe inside. So it is only the mother who is breathing, and if her level is and if it is lesser, that will suffice only her needs. But we want the baby's needs also to be fulfilled. So the hemoglobin levels have to be checked again.
And one thing more, ma'am, these days some thalassemia test has also come into picture.
Yes.
I don't know if I'm right in the pronunciation or not, but what is your take on that? Is it okay to do, or what? Why is it important?
Yeah. So thalassemia is a genetic problem. Now there are again three types of variations in that. We call it as thalassemia major and thalassemia minor. So these are genetic defects when either of the parent or both the parents have this genetic defect in them. If this defect comes in the baby, then the baby is obviously going to suffer from thalassemia. And then it becomes a very rough path ahead, because thalassemia is something that in which you need constant blood transfusions,
Okay.
and somewhere this becomes very rough for parents. So what we do is we first, it is like a screening test. We screen parents whether they are normal, whether they have these genetic issues, and if in case they have this, they can overcome this by using other gametes, or at least we are confirmed whether this patient is going to whether her hemoglobin is going to increase or not, whether she is going to suffer from any other problems and all. So thalassemia, checking for thalassemia is again very important.
Okay.
Now these, when I talk about routine, it is something that government has decided. And these are the basic. You cannot skip whatever I told you. You cannot skip anything from that.
Yes, ma'am.
These tests, again, government has been working tirelessly to include these tests also in the routine investigation protocol. Thalassemia and sickle cell anemia. Now, these two things are also being included. So, electrophoresis and sickle test. So, both these tests are also included these days, and it is very important to rule out these things also.
Okay.